very hardy. Welcome to all my brothers and sisters into Knowledge Park, the ultimate guide to blood tests, your body's diagnostic report. It's time to change that. It's time to become the expert mechanic of your own health. Your blood is a flowing database containing over 10,000 unique signals about your health. But what do these signals mean? Today, we are not just scratching the surface. We are diving deep into the ultimate encyclopedia of blood tests. This is the only guide you will ever need. To understand the tests, we must first know the system. Blood isn't just a liquid, it's a complex organ with parts. Red blood cells, RBC, carry oxygen. They grab it in the lungs and deliver it to tissues. White blood cells, WBC, defend you. Neutrophils chase and eat germs. Lymphocytes make and direct antibodies. Monocytes help with targeted cleanup. Eosinophils fight parasites and allergies. Basophils release histamine in reactions. Platelets act as the repair crew, activating where you're injured, building a fibrin net to stop bleeding. Plasma is the liquid highway, making up about 55% of blood. It carries cells, nutrients, hormones, proteins, electrolytes, and waste, keeping everything moving. Meet the Master Checkup, two powerful panels that turn your blood into clear numbers. CBC, the complete blood count. CBC looks at your blood cells. It checks white cells for infection and immune activity. It checks red cells and hemoglobin, HGB for oxygen delivery, and the cell indices for size and shape clues. It also measures platelets to see if your blood is ready to clot. CBC, quick normals for adults. WBC, 4 to 11 times 10 to the 3 per microliter. RBC, 4.1 to 5.9 million per microliter. Hemoglobin, HGB, 12 to 17.5 grams per deciliter. Hematocrit, HCT, 36 to 53%. MCV, 80 to 100 femtoliters. RDW, 11.5 to 14.5%. Platelets, 150 to 450 times 10 to the 3 per microliter. Differential, neutrophils 40 to 70%, lymphocytes 20 to 40, monocytes 2 to 8, eosinophils 1 to 4, basophils 0 to 1. Now the CMP, the Comprehensive Metabolic Panel, CMP. It checks organs and body chemistry. Electrolytes, sodium 135 to 145, potassium 3.5 to 5.0, chloride 98 to 106, CO2 22 to 29 millimoles per liter. Anion gap, typically about 8 to 16, helps judge acid-base balance. Glucose, fasting, 70 to 99 milligrams per deciliter. Kidneys, BUN 7 to 20, creatinine 0.6 to 1.3, estimated GFR 60 or higher. Minerals, calcium 8.5 to 10.5, magnesium 1.5 to 2.5, phosphate 2.5 to 4.5 milligrams per deciliter. Uric acid, men 3.5 to 7.2, women 2.6 to 6.0 milligrams per deciliter. Proteins, total proteins 6.0 to 8.3, albumin 3.5 to 5.0 grams per deciliter. Liver, AST 10 to 40 units per liter, ALT 7 to 56, ALP 44 to 147, total bilirubin 0.1 to 1.2, GGT roughly 7 to 50. Together, the CBC and CMP flag anemia, infection, clotting issues, dehydration, and early liver or kidney stress, often before you feel a thing. Tier 2. Targeted investigations, the follow-ups that answer why. When basics raise a flag or symptoms point a direction, we go targeted. First, heart and metabolic risk. Doctors order more precise tests to get clear answers. These targeted checks add context to the big picture. Heart and diabetes health. Lipid panel. Your cholesterol profile for cardiovascular risk. Total cholesterol. Desirable under 200. LDL. Optimal under 100. HDL. Protective over 60. Triglycerides. Normal under 150. Advanced lipids refine risk. ApoB counts atherogenic particles. Lower is better. Lipoprotein a is largely genetic. Higher levels raise risk. High sensitivity C reactive protein reflects vascular inflammation. Under 2 milligrams per liter is desirable when well. Hemoglobin HbA1c shows your 3-month average blood sugar. Normal is under 5.7%. Prediabetes, 5.7 to 6.4%. Diabetes, 6.5% or higher. Fasting insulin and HOMA-IR help spot early insulin resistance. The oral glucose tolerance test detects early diabetes and gestational diabetes when fasting glucose or hemoglobin HbA1c are borderline. Homocysteine, higher levels may raise cardiovascular risk and can signal folate or B12 deficiency. C-peptide shows your own insulin production. Fasting is typically about 0.5 to 2.0 nanograms per milliliter. Cardiac biomarkers. Troponin, the heart damage protein. CKMB, these rise when heart muscle is injured, critical to diagnose a heart attack. BNP or NT-proBNP increase with heart failure and fluid overload. Hormones and glands. Thyroid panel, TSH is the usual start, T4, T3. Together they diagnose hypo and hyperthyroidism. A common TSH range is roughly 0.4 to 4.0 milli-international units per liter. Thyroid antibodies, anti-TPO and anti-TG, support autoimmune thyroiditis. TSI, also called TSH receptor antibodies, supports Graves' hyperthyroidism when TSH is low, and T3 or T4 are high. Free T4 and free T3 refine thyroid assessment when indicated. Reproductive hormones, testosterone, estrogen, FSH, LH, and progesterone. These guide fertility, menstrual concerns, and menopause care. Prolactin helps when periods are irregular, there is infertility, or nipple discharge. Adrenal hormones, cortisol and aldosterone, assess stress response and salt balance disorders. DHEAS supports adrenal function and androgen excess evaluation. Inflammation and autoimmunity. C-reactive protein, ESR. Both are non-specific indicators of inflammation. ANA, RF, anti-CCP. These detect antibodies and support diagnoses like lupus and rheumatoid arthritis. Complement C3 and complement C4 help assess autoimmune activity and some kidney inflammation, especially with matching symptoms. Celiac screening, anti-tissue transglutaminase IgA, helps when anemia, diarrhea, or malabsorption are unexplained. Vitamins and minerals. Vitamin D, the 25-hydroxy test, supports bone and immune health, generally adequate at 30 nanograms per milliliter or higher. Vitamin B12. Folate, essential for nerves and red blood cell production. Methylmalonic acid confirms functional B12 deficiency when B12 is borderline. Iron. TIBC. Ferritin. These diagnose iron deficiency anemia or iron overload, also called hemochromatosis. Transferrin saturation, typically 20 to 50%, shows how much iron is bound. Reticulocyte count reflects bone marrow response in anemia. Hemoglobin HGB electrophoresis identifies thalassemia traits and sickle cell disease when the anemia pattern suggests it. LDH rises with tissue breakdown. Track trends with clinical context. Clotting and bleeding. PT/INR, PTT, fibrinogen. Coagulation tests monitor blood thinners and help diagnose bleeding disorders. D-dimer helps rule out an active clot when clinically indicated, not a routine screening test. Infectious diseases. Blood culture and sensitivity diagnose sepsis and guide effective antibiotics. HIV, hepatitis panels, Lyme, EBV. Serologies detect antibodies or the pathogen to show current or past infection. Procalcitonin helps distinguish bacterial infection and guides antibiotic decisions. Serum lactate flags poor tissue oxygen delivery and helps manage sepsis or shock. Cancer markers, not for general screening. They are used to monitor known disease and treatment. Your clinician interprets trends with context. PSA for prostate, CA-125 for ovarian, CEA for colorectal cancers. AFP helps monitor hepatocellular carcinoma and germ cell tumors. CA-19-9 supports pancreatic and biliary cancer care. Elevations can occur in benign disease. Beta-HCG confirms pregnancy and monitors some germ cell tumors. Genetics and toxicology. Karyotype, BRCA1, BRCA2. These help diagnose genetic disorders and inherited risks. Therapeutic drug monitoring, lithium, digoxin, keeps medication levels safe and effective. Toxicology and heavy metals, lead, mercury, check for harmful exposures and drugs of abuse. Up next, putting it all together. Targeted tests add clarity beyond the basics, interpreted with your story and symptoms. Parathyroid hormone, PTH, clarifies calcium problems and parathyroid disorders. Cystatin C can improve kidney filtration estimates, especially when creatinine misleads. Lipase helps assess pancreatitis when symptoms fit. Serum protein electrophoresis and free light chains detect monoclonal proteins in suspected myeloma. Thyroglobulin and calcitonin monitor thyroid cancers under specialist care. Aldosterone-renin ratio screens primary aldosteronism in difficult hypertension. IGF-1 helps evaluate growth hormone excess or deficiency. Anti-Mullerian hormone estimates ovarian reserve for fertility planning. Fructosamine, 2 to 3 week glycemia tracks, 2 to 3 weeks of average glucose when A1C is unreliable. Haptoglobin often falls in hemolysis and supports the workup. The direct antiglobulin, or Coombs test, direct antiglobulin test detects immune red cell destruction. Positive ANA can reflex to anti-double-stranded DNA and ENA panels for specificity. ANCA antibodies support diagnosing vasculitis when symptoms and labs suggest it. GAD65 and islet antibodies indicate autoimmune type 1 diabetes. IGRA tuberculosis blood tests detect immune sensitization without a skin test. Helicobacter pylori, H. pylori antibodies suggest past exposure. Stool or breath tests confirm active infection. Morning cortisol with ACTH clarifies adrenal function when symptoms suggest imbalance. Soluble transferrin receptor helps distinguish iron deficiency from inflammation-related anemia. Free testosterone with SHBG refines androgen status and symptoms. Zinc transporter, 8 antibody supports autoimmune type 1 diabetes diagnosis, alongside GAD and islet antibodies. Preparation. Get ready for your test. Fast if your clinic instructs you. Stay hydrated. Tell staff about all medicines and supplements. Venipuncture, the blood draw. A skilled, sterile draw from a vein. A tourniquet helps find a vein. Vacuum tubes fill quickly. The process is quick and precise. Labeling and transport. Your sample is barcoded, logged into the lab system, shipped in a temperature-controlled courier, tracked with real-time scanning. Lab analysis. Automated analyzers measure blood counts. Automated analyzers measure chemistries. Cultures grow separately in incubators. A microbiologist identifies microbes if needed. Pathologist review. An expert validates results. They add clinical context. Urgent or abnormal results are flagged. The report. A secure digital summary reaches your clinic. Your doctor explains results and next steps. Your lab report lists your result next to a reference range, the usual values for that lab. If your number sits outside that range, it may be flagged high or low. Here's the golden rule. Doctors don't judge from one number. They look for patterns across tests and connect results. Then match them with your symptoms and history. Interpret patterns, not just numbers. For example, RBC down, iron down, ferritin down. Together, that pattern often suggests iron deficiency anemia. Your clinician confirms the cause and guides treatment. Do not self-diagnose. Read the pattern, not just the numbers. That's how a report becomes a plan. From the basic CBC, complete blood count, to specialized panels, we've covered the map. Each blood test is a piece of your unique health puzzle. Together they guide prevention, catch risks early. They support diagnosis, turn clues into clear answers, and they shape treatment, so care fits you. Your blood is the most detailed report you'll ever read. Make sure you have the right translator. Listen to it, understand it, act on it. Thank you for watching. Please like this video. Share it with friends and family. Subscribe to Knowledge Park. Tap the bell to never miss updates.